And joining us now via Skype to explain to us how closely they are monitoring this situation on that Japanese cruise ship is Dr. Lwazi Manzi via Skype. She speaks on behalf of the National Department of Health. Dr. Manzi, very good morning to you, and thank you very much for your time this morning. Can we just start there with this report I've just read about those 2 South Africans on the Japanese cruise ship who have tested positive? Of course, we understand there's 10 others who are working on that ship. What's the latest you've got for us?
Thank you for having me. Yes, indeed, we do have 2 South African crew members who are working on board the Princess Diamond cruise ship who have tested positive for COVID-19. The 2 crew members have, of course, been immediately transferred out of the cruise ship, and they are currently in a facility in Japan. They are asymptomatic, they're very well stable, and they are being kept in isolation for observation, for an observation period until they can be completely cleared to be able to be released from that observation area. Now, the other 10 crew members are still on board the cruise ship, because the cruise ship at the moment is still disembarking their passengers whom they are prioritizing over the crew members. Once the crew members, which include our own, once the passengers have all been disembarked, which they hope will happen by the end of the weekend, then all of the crew members, including our own, will then undergo their series of testing before they'll be allowed to disembark. Having said that, you know, there were 3,700 people on board that cruise ship, and there were about 175 who tested positive. Now, that is a significant, in fact, that's the highest rate of infection in any one area in the world. So that's quite a significant amount of exposure. Therefore, all of the crew members that will be disembarking will still have to undergo a 14-day quarantine period before they'll be allowed to actually move any further. So these are all precautions that do need to be taken to ensure that the risk that has come from that ship doesn't pose a further risk to any people that may come into contact from those crew members that have disembarked from the ship.
Is it likely, from your knowledge and the information you have available, that of the 10 other South Africans who are members of the crew aboard the ship who've yet to be tested could test positive?
Look, it's very difficult to predict that kind of thing, you know. All you can say is that 705 out of 3,500 have tested positive. We know. These members will be retested before they're allowed to disembark. All we have is that rate, and we can't say that it will be those 10 South Africans who may or may not pick up the virus. So all we can do at this stage is just take all of the necessary precautions to ensure that we are able to detect and contain the spread of that virus from that particular ship.
But if they would be, when that time comes after they've been retested, of course, you would advise us.
Of course, absolutely. You know, we will be, and as far as coronavirus is concerned, the Department of Health has been issuing daily updates, and these daily updates have always been updates from anything that has been emerging. And we have kept the public informed, and there's no reason why we should, derail from that particular process.
Yeah, how should we ensure that information you are issuing daily is disseminated far and wide? I'm asking this, Dr. Manzi, on the background. I mean, one picks up a lot of nonsensical misinformation due to a lack of factual knowledge about what is going on. How do you think the department could widen the reach of its information?
In fact, it's not just the Department of Health that is disseminating information. We work very, very closely with the AICD, which also disseminates information, the WHO. You know, at the end of the day, you can disseminate as widely as possible. We disseminate amongst ourselves. We disseminate on social media, with credible organizations, whether they be governmental organizations or multilateral organizations. And of course, the media has actually played a really great role, because whatever information we've disseminated, they've actually been quite close to the truth. So in the professional environment, there's only so many places that you can post that will be credible websites. We cannot stop fake news from going out there, but what we do is that we engage those fake news online. We do use advanced technology, we use bots, etc., to actually scour the online platform, and we do actually actively engage those platforms that are outside of the professional space and refute any misinformation that's going out there. But for the general public, we engage the media, every single day. I'm on the phone or on eNCA like I am now, or on other platforms, and the minister and also other officials, just about on a daily basis, we are communicating on this virus. I would really encourage the public that if they see any misinformation, they really do reach out to the platforms that are credible, like the WHO, the NICD, and the Department of Health website. Those are the places where you will get credible information. Any other information is a matter of speculation, really, and you cannot really gauge where, to what extent there is truth or sensationalism on those platforms. So it really is the onus that's fallen on every person to try and be as discerning as possible. We have been doing our part, really, but of course we are always ready to engage on any platform to engage on communicating on this issue, because it is an issue that causes a lot of people concern, and wants to ensure that there is no panic in South Africa. We don't have the virus yet.
Yeah, I know. We need cool heads. Hey, the line, it looks like it wants to break. I'm hoping it can hold a little bit longer. Dr. Manzi, what about those South Africans now who are still in China? We understand that presidency has announced that there's about 132 in Wuhan city who have requested to be evacuated and come back home. Where is that process at? Can you share any more details with us at this stage from the Department of Health?
Yes, so we will in fact be holding a press briefing where the ministers that are involved, the departments that have been mandated to carry out this operation, will be able to give more details. But just to say that essentially this is a military operation, and therefore it does fall under the auspices of defense for a very large part of it, particularly, the most practical aspect of actually carrying out this operation. So to that extent, I will not be able to comment. But what I just do want to say to everybody at this stage is that the most important thing about this mission is, number one, that we have heeded the call that our citizens have made and responded to that call, because we are a caring government and we do absolutely care and have great concern for our citizens that are living in Wuhan in China. So we have responded to that call. The second most important thing is that these people are not sick. These are people who are well. Nobody has coronavirus. No South African has coronavirus who's living in China. These people that we are repatriating are people who are living under lockdown conditions in Wuhan, and for various reasons have made this request to come back home. So we are dealing here with a group of very healthy people who are COVID negative, but who have had significant exposure. And the most important task is for us to ensure that we keep it that way, that when they do come back into the country, we ensure that there is no risk of them, if for whatever reason, if they do come in with coronavirus, there's no risk of them spreading it. So the isolation chain is going to be a very, very important aspect of it. And this is where we really appeal for the cooperation of both the media and of the families, the concerned family members, friends, associates, colleagues of these people who are coming in, to say, really, we do need to ensure that they remain isolated for the period that they need to be quarantined, so that they allow the incubation period to pass and ensure that we are able to monitor them and do all of the necessary testing before they are reunified with society. The process has to be it has to be humane. The process has to be safe. It has to remain isolated, and it has to really be carried out in the spirit of calm and of safety for all South Africans, and particularly, of course, those who have been exposed, the ones that we are repatriating. Those are really the most important principles that everybody needs to understand.
Okay, Dr. Manzi, you've made it very, very clear. I understand. In my intro, when we started this program, I said that, yes, of course, they must come back home. Their families want them back. They have not contracted any disease. They are not sick, as you say. But I said it's important that a government must provide us factual information and must be transparent and assure us that every measure possible has been taken to prevent the entry of coronavirus into the country.
We absolutely are in line with that thinking. Remember that, as I said, being a military operation, there must be a certain element of responsibility in the way that, one, the operation is carried out, and two, the operation is communicated. We can communicate only to the extent that it is actually not going to breach any confidentiality issues of these repatriates, and that it's not going to breach any issues of public safety. Now, remember, this is a decision that was taken by Cabinet really only very recently. As much as there has been preparatory work, there is still a number of steps that need to be followed before the actual operation takes place. Now, of course, this is a matter of extreme urgency. We're talking here a matter of days. What we communicate is what we are able to communicate, because these are the things that have in fact been completely settled on. At the time that we are able to communicate, the mandated department and the department that is responsible for those particular operations, as I say, in particular defense, will be able to make the necessary communications to the public. At the end of the day, we want to ensure that everybody is informed to the extent that we ensure that everybody remains safe and the dignity is protected of all involved individuals as we communicate on this matter.
Okay.
We really want to ensure everybody that we are carrying this out in a manner that is very, very caring and that is very cognizant of the dangers of potential exposure of COVID-19.